So why MDMA for couples? It potentially opens the heart the way other drugs open the mind and spirit. It's called a heart opener. It can increase empathy. So it's technically called an empathogen. And I read this great apocryphal story with this guy in the early days of MDMA. He was a distributor and trying to popularize MDMA, and they said, well, why did you call it ecstasy then? He says, because ecstasy is going to sell a whole lot better than empathy. It increases bonding, empathy, intimacy, potentially. And it may reduce performance anxiety. You notice that women have as much performance anxiety as men now? When I was growing up, men were the ones that performance anxiety, that they were not be good enough lovers. But now, a young friend of mine, a pickup artist, I asked him what makes a woman good in bed, and he says, the number of times she can come. I thought, my God, what performance anxiety is that? What performance anxiety is that? So anyway, it could reduce performance anxiety. And partners may be able to communicate, although what is not spoken will harsh the buzz. So there's a fantasy that couples should just take ecstasy and they'll get along better. They'll get along great. And sometimes that happens. And sometimes it brings up all the stuff that you haven't talked about. And sometimes because that is because of these blocks we have in our throat and we can't talk, and maybe there's stuff we can't talk about. Some people, I remember being at Burning Man once, taking something that was supposed to be ecstasy and didn't even get high because maybe we're blocking, we don't want to feel it. So it isn't always this panacea that people would like it to be. So in MDMA couples therapy, what we would do rather than just give people ecstasy is we have an assessment on what's going on in the relationship, what might come up. Then they might take MDMA together, and then there would be counseling and integration afterwards rather than just getting high. It's being used therapeutically, like MDMA is being used. How many are aware of the MAPS trials where MDMA is being used successfully to treat PTSD? And MAPS is predicting that it will become a legalized treatment for PTSD as early as 2021.